6 medications that skyrocket heart attack risk in seniors over 60. Warning! If you're over 60 and take any of these 6 medications, pay close attention. Right now, in decades working in the ER and cardiac ICU, I've lost count of how many patients came in with a massive heart attack after taking one of these meds the night before. The worst part, they were almost always prescribed by a doctor. Today, I'm going to show you who these villains are and how to protect your heart before it's too late. And look, one of the last ones on the list is going to shock you. It's a pill that's sitting in the medicine cabinet of almost every adult over 60. Could it be in yours? But first, hit the like button, subscribe to the channel so you don't miss any of our health tips, and turn on the notification bell. And please spread this knowledge with your friends and family. By sharing, you could literally save the life of someone you love, and they will be grateful for the rest of their lives. So share it and let me know in the comments. If you've ever had a heart attack, did you suspect a medication might have caused it? Which one? And where in the world are you watching from? Write it below. Let's review the 6 hidden villains item by item. Grab a pen and a paper. But first, an important warning. This video does not replace your doctor's advice. Do not stop any treatment on your own. Ready to take notes? Villain number 6, decongestants. So, villain number 6, you've probably used this one plenty of times. Decongestants. The hidden enemy inside your cold medicine. You know the scenario, right? You have the flu of the century. Your nose is cemented shut and you can't breathe. You run to the pharmacy and grab Sudafed, Dayquil, or Afrin. In 20 minutes, it feels like a miracle. You can take a deep breath again. But here is what no one tells you. Drugs like pseudoephedrine and phenylephrine don't just act on your nose. They act like a clamp that squeezes the blood vessels in your entire body, including the arteries that feed your heart. They release noradrenaline, the stress hormone. Imagine your heart right now. It starts beating faster, trying to push blood through the pipes that just became stiff and narrow. If you're over 60 and already have a plague of fat here or there, this pressure can cause a spasm. The artery closes up and won't open on its own. It's a heart attack you bought yourself. One study showed that these medications double the chance of having a heart attack or a stroke in the hours following their use. And the worst part, in 2023, the FDA concluded that oral phenylephrine, which is in almost all cold medicines, is completely ineffective. In other words, you are accepting the risk of a heart attack for a benefit that doesn't even exist. It's a worst deal of your life. What should you do? Saline solution, nasal rinses, a humidifier. If things get really bad, use loratadine Claritin, which is much safer. Don't trade your life for 20 minutes of an unblocked nose. Villain number 5, NSAID, anti-inflammatories. And there's another trap. Older patients often take cold medicine along with this. You know the drill. You wake up with a headache and take an ibuprofen or Excedrin. Back pain? Aleve, Voltaren, Motrin. Seems normal, right? After all, they are the best-selling drugs on the planet. But what happens inside your body when you swallow that pill is terrifying. Imagine that your arteries have a private bodyguard called prostacyclin. Its job is to keep the blood pathways open and prevent platelets from sticking together and forming a clot. When you take ibuprofen, diclofenac, or naproxen, you block an enzyme called COX-2, and you fire that bodyguard. Without it, your body goes into a triple collapse. First, the vessels tighten and your blood pressure skyrockets. Second, the blood turns into glue. The platelets get sticky and form clots and thrombi. Third, the heart gets overloaded. Your kidneys stop filtering properly, holding onto water and sodium. The heart starts beating with an absurd force just to keep up. In short, it creates the perfect storm for a heart attack. Narrow vessels, clots, exhausted heart. And I'm not just saying this to scare you. In 2015, the FDA slammed their fist on the table and reinforced their official warning. The risk of a heart attack can start in the very first weeks of use, even in people who have never had heart problems in their lives. Look at these numbers I brought from studies by the Mayo Clinic and JAMA. Diclofenac, often sold as Voltaren, increases the risk of cardiac event by 70%, while ibuprofen, in high doses, more than doubles your chance of having a heart attack. But heads up, for relief, there is life-saving exceptions. Low-dose aspirin or baby aspirin does the exact opposite. It protects you. And acetaminophen, Tylenol, which is a pain reliever and not an anti-inflammatory, is also an island of safety for your heart. So, if the pain hits, don't play dice with your life. Talk to your doctor about these safer alternatives. Villain number 4, omeprazole and proton pump inhibitors, PPIs. This is the medicine I said would shock you. Omeprazole, pantoprazole, Nexium. These famous stomach protectors are in the bags of 70% of folks over 60. Everyone thinks it's like water. That's completely safe, except science discovered something surprising. PPIs don't just act on the stomach. They attack the cells that line your blood vessels. You know nitric oxide, right? That gas that keeps your arteries relaxed and youthful. These drugs crush its production. Without that gas, your vessels become stiff, inflamed, and atherosclerosis speeds up. A Stanford study with almost 3 million patients showed that those who use omeprazole and its cousins have up to a 21% higher risk of heart attack. This even showed up in healthy young adults. Another study showed that chronic use can double the risk of a cardiovascular death. The warning here, I'm talking about people who take it for months or years without stopping. If it's a short-term use, like 7 days for gastritis, don't panic. The danger is the blind, endless use. Let's leave the stomach now and enter the brain. The next villain is the trending drug. Adults in their 60s are taking this to perform better at work. You can probably guess what drug it is. Villain number 3, stimulants for ADHD, focus, and weight loss. Ritalin, Advance, Concerta. What used to be a drug for hyperactive kids became a fever among adults wanting total focus. Studying for a big exam? Advance, Ritalin. The problem is they flood your blood with adrenaline. Your heart beats 10 times faster, your vessels constrict, and your blood pressure spikes. A 2023 Swedish study tracked 278,000 people and revealed 5 years of use increases the risk of cardiovascular disease by up to 27%, and the risk of hypertension jumps to a terrifying 80%. And for those over 66, the risk of hospitalization for a cardiac event rises 40% in just the first 30 days. Be careful with natural stuff too. Those weight loss pills and pre-workouts from the supplement store, many high dangerous stimulants that the FDA never approved or has already been banned. Villain number 2, corticosteroids, prednisone, Decadron, and the famous cortisone shots. You know that shoulder pain that disappears in 2 hours with an injection? A miracle, right? Except that steroids attack your heart through 4 pathways simultaneously. They retain sodium so your pressure goes up, they spike your glucose, they ruin the cholesterol, and they thicken your blood, promoting clots. A study published in the PLOS Medicine showed that doses of prednisone above 7.5 a day used for a prolonged time double your cardiovascular risk. The trap: a patient gets a cortisone injection and thinks it was just a little prick. In reality, that one ampoule is equivalent to taking pills for almost a month, overloading the heart in a silent and dangerous way. And now, the last one, the most controversial, the elixir of youth that became a craze among men over 50 and women in menopause, which can be a Russian roulette if used the wrong way. Villain number one: testosterone injections, pellets, hormone chips, testosterone gels. Clinics have exploded prescribing this. Many men are using it without even have a proven deficiency. My testosterone was at 500, so I had to take it, right, doc? Was it really that low? You shouldn't have taken it. In 2014, a study with 55,000 men showed that in the first 90 days, the risk of a cardiovascular attack increased by 36%. In men over 65, that risk doubled. And look, when it doesn't cause a heart attack, it causes a stroke. I had a super healthy patient pass his full checkup perfectly, but who had a stroke and is now in a wheelchair, all after taking a testosterone injection. Just one day after the injection, because his wife was younger. The result: his wife left him. Why did this happen? Because testosterone can make your blood as thick as honey, and thick blood clogs things up, right? Oh, but I see the comments down below. Doc, I only use the gel. It is not that strong. Hold on a second. Don't fall for that. A study published in JAMA showed that testosterone gel significantly increases the volume of non-calcified soft plaques inside your coronary arteries. Those are the most dangerous plaques, the ones that look soft but can rupture at any moment and cause a massive sudden heart attack. And what about the beauty chip? I feel so good, so energetic, my libido is through the roof. Let me give you my clear and firm opinion right here. I am against the use of exogenous testosterone that your testicles don't produce, except in extremely selected cases with proven deficiency and constant monitoring. Period. Now, there's a gray area. A 2023 study called Transverse showed that in highly selected and monitored patients, testosterone can be safe. Repeat, highly selected. The danger is that pretty clinic run by a newly graduated doctor who wants to make quick money, or that shady backward clinic. A bunch of colleagues from online diploma mills barely passing their boards, prescribing it even for women who have breast cancer just because they are sarcopenic and lack muscles. It's a joke, right? I literally saw a case like this year. Her oncology practically pulled all her hair out in frustration. Sad, right? Using high doses without baseline testing and without monitoring your blood is playing dice with your life. Recap: anti-inflammatories, decongestants, omeprazole stimulants, steroids, and improperly prescribed testosterone. My request to you: do not stop anything on your own. Take this information, bring it to your trusted doctors, the one you like, and ask, doctor, do I really need this? And there's something safer for my heart. That single question saves lives. Do you want to know what protects it? The Cleveland Clinic listed the 6 medications that best armor your heart. If you want me to make a video on that, write protectors down below. If I get a lot of comments, I will record it, okay? Remember to like and share the video. My name is Dr. André. I'm a cardiologist, and this is Dr. Dre Health Tips. Remember to subscribe, and I'll see you in the next video. Thank you so much.